Okay, so this is SAS view, and in transverse view it's with the upper pole. See, there's a simple cyst. Then you have to remember that some benign nodule adenoma can look like hypoechoic to anechoic. Very dark. Then click the color. If it's cyst, there will be no color inside. If it's a tumor, there will be color inside. And it should exhibit the 4 criteria of a simple cyst. If this is the, if see the thyroid gland, this is transverse view, then you have to take the history of trauma or surgery. If there is a trauma, there might be a hematoma, blood collection. Or if there is a trauma or injury, it can be a necrosis. So where there is a necrosis, always there is a collection of fluid that looks like simple cyst. Beside this simple cyst, you might get the thyroglossal duct cyst. Thyroglossal duct, as I told you before during the anatomy, in the neck. So if this is the neck, the base of the tongue is here. This is the base of the tongue, and with the base of the tongue, the thyroglossal duct is coming, and thyroglossal duct is attached with the isthmus. So this is isthmus. This is tongue. This is thyroglossal ducts. Thyroglossal duct. Normally, this thyroglossal duct gets atrophies. If it does not get atrophies, it has a live tissue and it produces fluid. The fluid trickles down from top to the bottom. So if it is not fibrosis at certain point and it still is alive like this, when it is not fibrosis, a piece is still alive and the rest of the part is fibrosis. Then this is known as thyroglossal duct cyst. This is thyroglossal duct cyst, and it exhibits the same 4 criteria of the simple cyst. It is superior to the thyroid in location. Yes, it is superior to the thyroid in location. It's a midline mass. It is in the midline, slowly enlarges and otherwise asymptomatic. And as it is in the midline, you ask patient, swallow please, then you will see it is moving up and down because it is attached with the base of the tongue. Okay, so if you ask patient to pull out the tongue, protrude the tongue, then you will see it is moving. It is moving up and down. So that is thyroglossal duct cyst. It is a midline mass. Slowly enlarged and asymptomatic. Now we'll talk about the inflammatory processes. Inflammatory processes. Okay. So I'm going to erase this part. I need a space. So Hashimoto's thyroiditis. Look at here. Ditis, T-I-S. It means infection, inflammation. Hashimoto is the name of a Japanese scientist. Hashimoto's thyroiditis means thyroid get inflamed with some way. They said it could be virus, but now, as of now, they said it is mostly autoimmune disease. Then what is autoimmune?
Your body's fighting itself.
Yes, the body develops antibody against this thyroid tissue. And that antibody kills the thyroid tissue by antigen-antibody inflammatory reaction. So now, there will be a gradual enlargement. Gradual enlargement of the gland. It's not be overnight enlargement. Gradual enlargement and usually associated with hypothyroidism. But may be normal in function. Let me tell you. It is associated with hypothyroidism when at the advanced stage. Those who have Hashimoto's thyroiditis, I saw the case after 15 years. The total thyroid is vanished. No thyroid gland. The tissue gets dead, destroyed. But at the initial time, when there is an inflammation, there will be enlargement of the glands and may not have hypothyroidism. If you do the blood test comes normal. So, in advanced stage, the patient will gradually develop hypothyroidism. And when it is hypothyroidism, then we will understand what are the signs, symptoms of hypothyroidism. Usually have a family history. Family history positive. Usually they are having Hashimoto's thyroiditis in the family. It runs in the family, and it is thought to be autoimmune. immune disorder. So clinical symptoms, okay, it would be enlarged palpable thyroid gland. Enlarged palpable thyroid gland. Okay, so clinical symptoms. Okay, better put number 1 or A, B, C, D. Enlarged palpable thyroid gland. B, lethargy. What is lethargy means? Lethargy means very tired, cannot function, cannot work, very slow moving. And number 3, weight gain. Weight gain. Then D, intolerance to the cold. So they will say, I don't eat, but still I am gaining weight. So this patient needs to go for checkup. Hypothyroidism, they don't feel they are hungry because their basal metabolic rate is low. That's why they are having more anabolic work, not catabolic. Anabolism means gaining weight. And intolerance to cold, they are very cold. Their hand and leg are always cold. Intolerance to cold. And what else? Coarse, dry hair and skin. Coarse, dry hair and skin. You will see their skin, body skin and hair, they are all rough, tough, dry. You will see the hair that is splitting in the end of the hair, that is splitting into two. And mind confusion. This is called myxedema madness, mind confusion. Myxedema madness. G, menorrhagia. Menorrhagia in female. Remember this criteria. So these are the clinical symptoms: enlarged palpable thyroid gland, lethargy, weight gain, intolerance to cold, coarse dry hair and skin, mind confusion, menorrhagia. So they will give the questions with these sign symptoms and they will ask what type of disease is it. And keep that in mind advanced stage of Hashimoto's is hypothyroidism, but initially blood work may not be changed, but organ is enlarged. You will see the neck is full. What happened? Whole neck is full. Yeah, then you palpate. Oh my God, it feel like thyroid gland is enlarged and is painful. It can change the voice too because of the compression to the nerve. Okay, so usually diagnosed by lab data or nuclear medicine. Okay, so now how this disease can be or disorder can be diagnosed? Usually by the lab data. Lab means the blood work and nuclear medicines test. Okay. Diagnosis is done by lab data, means the blood work. They will see T3, T4, they are low, and increased TSH, thyroid stimulating hormone. And number 2, the nuclear medicine test. Nuclear medicines test. So in the nuclear medicine test, what they're going to see, if this is the thyroid gland, they will see the patchy area has no radioactivities. There's no functions. Some area, there are a lot of good area, but there is some area in radioisotope test. Then understand, these are the radioisotope all over the thyroid gland, but why? What happened here? What happened here? What happened here? What happened here? Why there is no radioactivities? Because those tissues are dying or dead. You click the color, you will see everywhere there is a blood vessels, but here there is no color. So it indicates that thyroid gland is dying gradually. Sonographic appearance, or you can say sono appearance. Sono appearance. So non-specific. When? Before the advanced stage, you scan the thyroid gland, you may not feel like, oh, there is a Hashimoto's thyroiditis. But in advanced stage, you will see that the whole thyroid gland is not seen. Patchy area are normal and some patchy area is not seen. So that is a clue that it may be Hashimoto's. And there will be diffuse enlargement. Decreased echogenicity. and heterogeneous. Thyroid gland is heterogeneous. Non-sonographic appearance, non-specific. Diffuse enlargement, you're going to get the enlargement, length, width, height. And echogenicity will be decreased. And heterogeneous. Why echogenicity will be decreased? Because there is a inflammation, collection of fluid inside. And heterogeneous. Why heterogeneous? Look at here. Because the area is dying, some area is normal. So this is all feature of hypothyroidism. Now Graves' disease that I am going to tell you, it is hyperthyroidism. Graves' disease, also known as thyrotoxicosis. It is a diffuse hyperthyroidism. Diffuse means all over. Thyrotoxicosis means thyroid is functioning more and it is producing toxic effect in the body. It is thought to be autoimmune disorder. Family history. Family history is positive. Okay. Thought to be made manifest by a trauma. What does that mean? If you simply hold the thyroid gland and is manipulated by the fingers, then you will see your mood will be swing. Mood will be changed. Why? Because the thyroid gland will release more thyroxine. That's why do not, even though you feel something palpable, do not even touch and manipulate like that. So it's going to cause hyperfunctions of the thyroid gland. Now, the clinical symptoms. Clinical symptoms. What are the clinical symptoms? Just opposite. Weight loss. In Hashimoto's, weight gain. Now it is weight loss. Number 2, nervousness. Number 3, increased irritability. Nervousness means tomorrow is interview. So the patient is so nervous. And fleeting of ideas, talking so fast, eating so fast, eating more, going to the bathroom for number 1, number 2 more. They walk fast, they do everything very fast. And they are very warm in the body. And they have sweat or moist in the hand. Okay, moist hand when you do the handshake. And heat intolerance, number 4. Heat intolerance. And number 5, exophthalmos. Exophthalmos means abnormal protrusion of the eyeball. Abnormal protrusion of the eyeball. That means you can see the eye like this. Look at me. Usually our black part, the cornea, right? It is covered by the upper lid and the lower lid, right? But there will be more protrusion of the eyeball and there will be retraction of the eyelid. As a result, you will see exophthalmos. So now the sonoappearance of the thyroid gland. You will see sonoappearance normal to enlarged, inhomogeneous, that means not homogeneous, it is heterogeneous, hypervascularity. Okay?
Don't they usually have goiters too?
See?
Goiters, don't they usually get goiters?
In the goiter, there's a iodine deficiency. There are 2 types: iodine deficiency and non-iodine deficiency. We're going to cover. The goiter is not Graves' disease. Goiter is not Graves' disease. Graves' disease, somebody has a nodule, right? For 2 years, 3 years, 4 years. Suddenly that nodule is hyperfunctioning. We will call it hyperthyroidism due to hyperactive nodule. But in Graves' disease, it is diffuse. Look at it, diffuse all over the thyroid gland. There is no nodule, but all over the thyroid gland is hyperfunction. Okay. What is the cause? They said we don't know, but we are guessing that it is autoimmune disease too. Okay, so now this is Graves' disease. It is opposite of Hashimoto's thyroiditis. Okay, now we'll go over the goiter.